All right, today we're going to take a deep dive into one of the most prescribed pills on the entire planet, Atorvastatin. We're going to pull back the curtain and see exactly how this tiny tablet works and why it became such a revolutionary weapon in the fight against heart disease.
And that is not an exaggeration. Atorvastatin, which you probably know by its brand name Lipitor, is prescribed to literally millions and millions of people all over the world. Its impact on public health has been so profound, it's really considered a cornerstone of modern medicine.
So here's our roadmap for this little tour. We'll kick things off with what atorvastatin actually is, then we'll look at its main mission, explore the fascinating way it works, cover a practical user's guide, and wrap it all up with the final verdict on its place in medicine.
Okay, so first up, a global medication. Before we get into all the nitty-gritty details, let's just get a really clear idea of what we're talking about here. What is this stuff?
So at its heart, atorvastatin is a member of a famous family of drugs called statins. Now, the technical name is an HMG-CoA reductase inhibitor, which sounds super complicated, I know, but we are going to break that down in just a minute. Really, its main job is pretty simple. Lower your cholesterol and stop cardiovascular events like heart attacks and strokes before they happen.
So, we know it's a statin and we know it fights heart disease. But what is its specific mission? Like, who are the people a doctor looks at and says, yep, this is for you?
Well, the mission is really four-part. First, you've got primary prevention. This is for people who haven't had a heart attack or stroke yet, but they have risk factors, maybe diabetes or high blood pressure. The goal here is to prevent that first event from ever happening. Then there's secondary prevention. That's for patients who've already had an event, and the whole point is to make sure it doesn't happen again. The third mission is just straight up treating high levels of what we call bad cholesterol. And finally, it's used more broadly to manage something called dyslipidemia, which is basically when the whole range of fats and lipids in your blood is out of whack.
Okay, now we get to the really cool part. How does this one little pill actually pull all of this off? The mechanism is just, well, it's incredibly clever. It's targeted, and it all goes down inside your liver. To get how it works, you first have to meet the main target. You could almost call it the villain of our story, an enzyme called HMG-CoA reductase. Just think of this thing as the master on-off switch for making cholesterol inside your liver. Now, your body does need some cholesterol, but when this switch gets stuck in the on position, that's when things get dangerous. Atorvastatin's entire job is to find this one specific switch and flip it off.
And it all happens in this just brilliant four-step process. First, atorvastatin finds that master enzyme and blocks it. Right away, the cholesterol production inside the liver just plummets. So what does the liver do? It senses this shortage, and it responds by building more little grabbers, LDL receptors, on its surface. It's trying to pull the cholesterol it needs from the blood. And these new receptors? They act like powerful little vacuum cleaners, just sucking all that dangerous bad cholesterol right out of your arteries. So you see, it doesn't just block the cholesterol you eat, it actually tricks your own body into cleaning up the supply that's already there. It's elegant.
But wait, the story doesn't even end there. Statins have what scientists call pleiotropic effects, which is a fancy way of saying they have bonus features. So, beyond just destroying bad cholesterol levels, they also reduce inflammation in your arteries, and they help stabilize those dangerous plaques that can break off and cause a heart attack. It's this 1-2 punch that makes the drug so incredibly protective.
All right, let's switch gears and get practical. With any medication this powerful, there are some really important things that both patients and their doctors need to keep in mind.
Look, most people handle it just fine, but like any medication, side effects can happen. The most common ones are usually pretty manageable, things like headaches or general muscle aches. But what's really important is to know the difference between those and the serious, but let me stress, rare side effects. Things like severe muscle injury or liver issues are things doctors watch for very carefully. But again, for most people, this is not a concern.
And this number really gets to the heart of it, right? It's all about weighing the risks versus the benefits. And the data is overwhelmingly clear. For the vast majority of patients who need this drug, the life-saving benefit of preventing a catastrophic heart attack or stroke just dramatically outweighs the pretty small risk of side effects.
Drug interactions are another huge piece of the puzzle. The best way to think about it is this. Your liver uses a specific kind of tool to break down atorvastatin and clear it from your body. But if another drug, or believe it or not, even something like grapefruit juice comes along and blocks that tool, the levels of atorvastatin in your blood can build up, and that increases the risk of side effects. This is why, and this is so important, you have to tell your doctor about every single other medication, supplement, or anything you're taking.
And finally, there are a few groups of people who just should not take this drug. That includes patients who have active liver disease,
It also includes women who are pregnant or breastfeeding because, a developing baby actually needs a lot of cholesterol to grow properly. And, of course, anyone who's ever had an allergic reaction to it in the past.
So, after our tour, let's bring it all home. What's the big picture takeaway here? What is the final verdict on icosapentavin's role in modern medicine?
I think the medical literature probably says it best. Atorvastatin is a cornerstone therapy. That's not just a fancy phrase. It means it's not just another pill, it is the very foundation of how we prevent atherosclerotic cardiovascular disease, which, by the way, is one of the biggest killers on the planet. The number of lives this drug has saved is just immeasurable.
And that really leaves us with one last thing to think about. Atorvastatin and the other statins were monumental, world-changing breakthrough for the 20th century. They completely changed the game for managing heart disease. So the big question now is, what's next? What's going to be the breakthrough that defines cardiovascular health in this century?